A patient presents at your hospital with pain. What would you prefer? Acetaminophen, an NSAID, or an opioid analgesic? Of course, depending on the severity of pain. You can find the detailed lectures on acetaminophen and opioids on sqadia.com. While here, we'll be discussing NSAIDs, their classification, mechanism of action, adverse effects, and the choice of NSAIDs. NSAIDs have antipyretic, analgesic, and at higher doses, anti-inflammatory actions. Though they are anti-inflammatory, but remember, they aren't steroids. If you remember from our lecture on acetaminophen, that acetaminophen, or commonly known as paracetamol, is often misinterpreted as NSAID, but remember, it is not an NSAID, because though it has antipyretic and analgesic action, but it lacks anti-inflammatory action of NSAIDs. Most of the patients consulting their general practitioners having some form of rheumatic complaint are frequently prescribed NSAIDs. If we talk about the different analgesics, I must say that millions of paracetamol and NSAIDs like aspirin and ibuprofen tablets are bought over the counter for the self-treatment of headaches, dental pain, various musculoskeletal disorders. But they are not effective in the treatment of visceral pain, as we experience in myocardial infarction, renal colic, acute abdomen, which requires opioid analgesics. However, NSAIDs are effective in certain types of severe pain like bone cancer. The NSAIDs form a chemically diverse group, but they all have the ability to inhibit cyclooxygenase, COX, and the resulting inhibition of prostaglandin synthesis is largely responsible for their therapeutic effects. We will discuss the detailed mechanism in this video later on. COX exists in the tissue as a constitutive isoform, COX-1, but at sites of inflammation, cytokines stimulate the induction of a second isoform, COX-2. Inhibition of COX-2 is thought to be responsible for the anti-inflammatory actions of NSAIDs, while inhibition of COX-1 is responsible for their gastrointestinal toxicity. Now, let's have a look at the COX selectivity of different NSAIDs. So, the graph here is showing different NSAIDs and their selectivity. Though most of the NSAIDs are non-selective or are more COX-1, while few of them are selective COX-2 or preferentially COX-2 inhibitors. While talking about non-selective COX inhibitors, let me introduce you to the different classes of non-selective COX inhibitors. Well, this classification is based on the chemical structure of NSAIDs. Some of them are the derivatives of salicylates, like aspirin, salicylate salts, and difenyl. Some are the derivatives of acetic acids that include indomethacin, tolmetin, sulindac, diclofenac, etodolac, and ketorolac. Next comes propionic acids derivatives. You must be familiar with the drugs like ibuprofen, phenoprofen, flurbiprofen, ketoprofen, naproxen, and oxaprozin, which are included in this class. Then there are a few oxycams too, like piroxicam and meloxicam, quite easy to remember. Well, lastly, we have phenamates like mefenamic acid and meclofenamic acid. Now, you must have comprehended from the selectivity graph that most NSAIDs are somewhat selective for COX-1, but more recently, selective COX-2 inhibitors have been introduced that include celecoxib, atorvastatin, and lumiracoxib. Having coxib at the end might help you to remember that they are selective COX-2 inhibitors. Though selective COX-2 inhibitors have similar efficacy to non-selective COX inhibitors, but these agents have proved to reduce the incidence of gastric perforation, obstruction, and bleeding by at least 50%. But on the other hand, they do not provide any cardioprotection and are associated with an increased incidence of myocardial infarction. If we talk about the inflammatory joint disease, among NSAIDs, aspirin was widely used in the treatment of inflammatory joint disease, but about half of patients could not tolerate its adverse effects like nausea, vomiting, epigastric pain, and tinnitus, caused by the high doses of soluble aspirin necessary to achieve an anti-inflammatory effect. So, for this reason, newer NSAIDs, yes, I am talking about selective COX-2 inhibitors. They are generally preferred to treat the symptoms of inflammatory joint disease like pain, stiffness, and swelling. Though most of the NSAIDs seem to have similar effectiveness. However, there is considerable patient variation in response, and so it is impossible to know which drug will be effective in an individual. Although 60% of patients will respond to any drug, but mostly the propionic acid derivatives, means ibuprofen and naproxen, are often tried first because they are associated with fewer serious adverse effects. So that was about the introduction and classification of NSAIDs. To learn about the mechanism of action of NSAIDs, keep watching next parts of the video.